obsessing about data and whatnot
Yeah.
comes from, feeling uncomfortable with ambiguity.
Yeah.
And there is a lot of that in dating,
Yeah.
and that's probably why I find it so awful
Yeah.
most of the time.
Yeah. So can you start just by introducing yourself?
So I'm Surafel Tsega. I am a hospitalist, so I'm a doctor.
Yeah.
And I'm a clinical informaticist. I work for the New York Health and Hospital System.
Uh-huh.
And that's it.
You're saying
That's
a lot
me.
of words I don't know. A hospitalist? What? That means you work at a hospital?
I work in a hospital.
Uh-huh.
Yeah.
Okay.
I'm an internist who takes care of patients when they're admitted to the hospital.
Okay.
So if you had pneumonia
Yeah.
and you weren't too sick to be in the ICU, I
Mhm.
would be the one taking care of you.
Okay.
Yeah.
And then there was a different word you used.
Informaticist.
Yeah.
Yeah. I basically help manage the electronic medical record. So it's a lot of like software stuff, very IT heavy.
Yeah.
And I do that for the system. So trying to design the EMR, the medical record, to make it easier for doctors to do good things and make it harder for them to do bad things.
Great.
Yeah.
I use medical record software.
Yeah, exactly.
It's horrible.
Yeah, exactly. Yeah.
Generally horrible.
Yeah.
You are also, you're so far best dressed guest. I didn't know that was an award that was waiting to be given out. You're the first.
Yeah.
You're the first person to wear miyaki.
Wow, thank you.
So congratulations.
Thank you. I thought long and hard about this.
It is award season.
I know, right?
So we talked a little bit beforehand about what we might speak about today, but I don't really know what you've thought about. But I've proposed the idea that we come to talk about heartbreak.
Yeah.
Can you start just by talking about what your associations were with that, and even maybe like a bit about how you decided what could be shared?
Yeah. I mean, I think when I DM'd you to say I really liked your podcast, I think it was after I just watched Charlie's episode, which was really good.
Isn't he great?
Yeah, he's great. He's amazing. The first thing that came to mind for me, and probably it's because I spend all my time in medicine, is like, as a doctor, you're coming across heartbreak in so many different ways that's very different from the romance, heartbreak, that type of thing.
Yeah.
So when you were, saying that you wanted to talk to me, I was like immediately thinking, well, I could probably spend just an hour talking about the heartbreak of being a doctor and, what I sort of see and kind of go through.
Yeah.
And particularly like as it relates to COVID, which was kind of that to the extreme.
Yeah.
So that was like my initial thought. But then I kind of started to think about it a little bit more and started to realize that maybe along that vein of like heartbreak, but not necessarily be related to like romance, I think there are other situations that I, have come across heartbreak that I would be, okay with sharing or interested in like talking about slightly different. Because I don't think I've necessarily had that type of romantic heartbreak that people, like I haven't had that Call Me By Your Name, crying into the fireplace while Sufi, like I haven't necessarily had that experience, right? Or not as much per se. So those things don't like resonate as much, or they don't stay in my mind, and like I don't come back to them in the same way that I do certain other like situations.
Why do you think that is?
That's a really good question, and I think one way when I think about it is that for the situations that I think about, like heartbreak, I have complete lack of control, and I am, but at the same time, there is no like question about what could, like, what was wrong with me or what was wrong with the situation. It seems very clear, like kind of laid out, as opposed to something like love where you are, not, sometimes you have this perspective and then you realize that the other person is like, actually, no, you presented X, Y, or Z way. This was, and you're kind of just like, kind of like shakes your foundation a little bit.
The intersubjectivity of it all.
Yes, exactly.
Yeah.
Exactly. And so I think that ambiguity really makes me uncomfortable.
Yeah.
And, my therapist is always like, you really thrive on having, concrete data.
Yeah.
And he's right, I do. And so whenever something's like more ambiguous, I kind of struggle with it. And so either I perseverate or I will just kind of like move on, and it just kind of like, it just doesn't exist in my brain anymore. It's sort of walled off.
When I started doing this, I was like, oh, it would be so cool to have a doctor come on and talk about like someone who could speak to the like science or biology of this. And then I thought of you. And so this is like, you're really like getting to I had a fantasy that you could provide this perspective.
Yeah. And it's funny that you said that, because I talked to my friend yesterday and I mentioned that I was going to be on here, and she said, "Oh, are you going to talk about the science?" And I was like, "Oh God, no! I don't know any of the science." I do.
But I don't even. What you're talking about is more interesting. Like, you're not saying like, "Well, this hormone floods your blah, blah," which actually is interesting. I've like read a bit of that, and it's like you're really biologically in a bad state during heartbreak, but.
And there's obviously like the broken heart syndrome. Have you heard of this?
Where people die?
I mean, sort of, but it's a form of heart failure that is the result oftentimes of either physical stress or emotional stress. And we don't really know exactly how it works, but it's a specific type of heart failure that people get in times of emotional or physical stress.
How can you tell that was the cause?
So, this type of heart failure, it changes like the structure of your heart in a very particular way.
It's so poetic.
Right? Like going through something, it like changes the structure of your heart. So when we look at how your heart is pumping and how it's functioning, it looks a little bit different. That's very characteristic of this. And oftentimes these people come in and everything shows that their like heart is stressed. But then when you take a look and say, okay, your heart is stressed, you must have a blockage in your artery, right? Like you're having a heart attack, and it's like completely normal. And it's everything else that's sort of revved up, if you will, and then has led to stressor and damage of your heart.
And that makes me worried for like anyone who has hypochondria that's watching this. You could be like get phobic about stress to the point of like the traffic will kill you, or the date's going to kill you, or something.
I mean, I've taken care of patients with it a lot, and sometimes there's like a third of the time you have no idea what could have been the stressor, and we don't know exactly what the cause is. But there are some times that are very like exactly like what you said, like very poetic, where it's someone who has like lost their husband and coming in several months later, and now they have sort of that. So
there's a thing of like when one of your grandparents die, it's often like, oh God, keep an eye on that other one. If they're a married couple or together. But I want to circle back to, which is like,
because that's all I know about that.
Which is that like you're more interesting than what I was imagining, like the biological part of this, although that is cool, is like that as a doc, like that maybe you are like someone who got interested in medicine and thrives in that there is something about your like psychology about finding the mess of the intersubjective world, the like emotional relationship stuff, that you're like, yeah, you're drawn to like data and science and like a place where you can feel more effective there or something like that.
Yeah, that's definitely, that's really the crux of it. I think I'm always sort of, desperate for feedback in some type of way. And I think in medicine, my medicine is a little bit slower than than other types of medicine.
Yeah.
But there is that gratification of doing something and then the next day seeing that, seeing whatever that action result in an improvement in a lab function or how the patient feels, like that type of thing.
Yeah.
That even though there's a lot of medicine where you're kind of just guessing a little bit and just sort of hoping for the best, and you may not actually see sort of the end result of whatever you're doing, especially for me. There is still a lot of satisfaction of just, doing something, and then the next day or 2 days later, the patient is like, oh, I can breathe a little bit easier today, and like, that type of thing. It makes up for all of the instances where I don't have control and have no idea, what works and what doesn't, and what should I do more of, what should I do less of.
So, but you're proposing that like in that context, in that arena, you're actually more open to the pain of the losses or the, like what I thought I heard you say was like, in dating and stuff, it's kind of like too confusing to even reckon with. So it's like, who knows what happened? I'm moving on.
Yeah.
But that the pain around the COVID experience, or I'm sure like every day there's something awful that you see, that the emotional pain of that is somehow actually like easier to access.
It is, yeah. And I think part of it is, part of it just comes down to I can, really remember the specific moments and exactly, what was going on, who the patient was, what they look like, that type of thing. And when it comes to something like, dating, after a while, it just becomes, oh, this random guy, I don't remember, maybe it was this person, maybe it was that person, I don't really remember that, that sort of thing.
Do you have like, do you have, how do you understand like being this way?
I don't know. I think,
or like, what are your like beliefs? Like what kind of lens do you use to be like this? Like, do you think about like in social work school, they say that it's nature through nurture, like that you maybe show up with a kind of character and then are raised a certain way or like in a certain environment, and then some configuration of you become who you become. Like, yeah, there's parts that are innate, and then the environment hits all of that, and then that produces what we call ourselves. But I don't know. I'm just curious how you think about that.
Honestly, I haven't really thought about that much. I guess I sort of think about it from a very kind of scientific way. I spend a lot of my time thinking about like, which personality disorders this person has, and like it sort of just falls into those buckets for me, and I think that's probably that's like the science. Like I don't actually think about that. I just think exactly sort of like this is what the person presents as. And so how do I deal with, their narcissism or their, their borderline personality or something like that.
Right, but are you using that rubric to understand yourself?
Probably not.
Yeah. Okay.
Yeah, and I don't think there's a
not suggesting your personality disorder, but I'm saying, but I might think about people as like, that like if someone's being like very intense in a particular way, it's like okay, which personality disorder, but But I guess I think about, there's this woman Nancy McWilliams, who wrote this book called, it's like, the name of it is like Psychoanalytic Diagnoses. And it's like, she basically is like organizing the DSM through the lens of analysis. So she's like, because in an analytic world, it's like easy to like be dismissive of diagnoses, and her thing is like, no, we like really like, this is real and we need to understand how people are working. But like the language of the DSM maybe isn't enough. So she's like fleshing it out with that theory. It's like like incredible. When I read that, I was like, I can't believe they don't give this to you in school. But when you look at it that way, her kind of thing is like, well, maybe that we all probably have like one dominant defensive strategy or one like that kind of thing.
Yeah. Yeah. I think I've sort of learned about that through therapy, definitely in a way. A lot of the obsessing about data and whatnot comes from, feeling uncomfortable with ambiguity. And there is a lot of that in dating, and that's probably why I find it so awful most of the time. And there's so much, and so I really just kind of block off and move away from that to something that feels a little bit more concrete. I think that's the most that, like, I don't really sort of evaluate myself through a rubric or think of myself in that way. It's just I sort of started to appreciate how certain things make me uncomfortable, and they, they get memory hold, like, and I don't, it's gone for a while.
Can you name a couple of the like aspects of dating that you find really hard? Because I just think like in my work, I feel like I encounter a lot of people, and I've been the client who's having this trouble as well. But like, I think it's so easy to have a fantasy that dating should be easy or enjoyable or something. I once had a therapist say, I said something about caring about, like, I really value romantic partnership. And he was like, no, you don't. I was like, I do, I swear. But like, and then he said, if that was important to you, I'd be hearing about way more bad dates. And I think he was operating from the understanding that like, there's like so many hard parts of it, which is like not a totally mind-blowing new idea. But I think it's just, I think it's good to have solidarity in how hard that is for everyone. And so I wonder about like, particularly, what do you hate about it?
I mean, just aside from sort of the theatrics of all of it, whether you're texting too much, texting too little, creating like that type of thing, kind of putting that all aside. The thing that I struggle with most is really that ambiguity of why it didn't work out very early on. Is it, did I say something weird? Was I offensive? Do they not like me because I like a certain housewife? And they're like judging me, that type of thing. Or is it like, was I too like aloof or or too chatty?
And all you can do is wonder.
And all you can do is sort of wonder. And so that happens a lot. But I think a lot of it is just, I sort of have to remind myself that it's just a random date. A lot of the times. And it,
I think that's what I find relieving about like thinking about things psychoanalytically, is it's like the vastness and complexity of someone else's subjectivity. I can just chalk it up to that. Like I can be like, who knows? Like there's like, we're all so complicated, and the reasons we're drawn to something or not is like, it's easy to make it like not personal, by being like, well, that's just like another crazy human, and like I can't account for it. So, but there, I think that I probably have like a defensive
No, I mean, it's
thing.
definitely, you're probably right. There's probably some sort of defensive component, but there's also reality to it, right? Like, if someone says they are, going through a lot right now,
Mm-hmm.
your gut reaction may be like, oh, they're just saying, like my gut reaction would be, oh, they're just saying this to let me down
Yeah.
easily.
Yeah.
But then I could, take a step back and say, well, actually, thinking about, what I have gone through during X or Y period,
Yeah.
I would say the same thing and it would be totally true.
Yeah.
So why am I
Yeah.
assuming,
Yeah.
why am I assuming that the other person is not being genuine in any sort of
Yeah.
way?
But just like the vulnerability of like of a date, like dates are so weird because on some level, I mean, like I've tried across my life to start a date thinking, I've heard the advice once of like just try to like have a fun night.
Yeah,
like what's the most fun you could have with this person given the setting.
Yeah.
But that's hard to do, and because on some level what's being asked of you is like, can you like pretend to be this person's boyfriend for the next 3 hours?
Yeah.
And it's so vulnerable because they haven't, you don't know if you can trust them or like who, if you like them. It's just is like,
Yeah.
it's scary. Um, I wonder if you could are willing to talk about some of the heartbreak of your professional life.
Yeah, I mean, obviously, because I'm here, and it was the first. It was the first thing that I mentioned.
Yeah, well, I'm curious. Yeah, I'm interested in what. I think people have fantasies about my job and like what might be the harder aspects of it, and it's often different than what people assume.
Yeah.
And so I'm curious about what's difficult.
I mean, I think a lot of what is difficult, people, can sort of imagine on a small scale, with like an individual person. If you have a loved one that's in the hospital, you can sort of imagine the stress and the anxiety that sort of goes into, that and the emotions that come with that.
Yeah.
And my day can oftentimes be, 10 of those people, trying to sort of like, navigate their emotions, navigate my emotions, etc. So I think it's going through that heaviness and then, getting in the middle of it all and then getting a text from a friend saying, hey, what are we doing tonight?
Yeah.
And it's like, okay, let me pause. Let me stop right here. So, and then I will get out of that mindset into this other mindset. And then there's a lot of compartmentalizing for sure.
Yeah.
But I mean, I think it's, often it just comes down to not necessarily mistakes or anything. It comes down to the stories and the patients and the situations. And actually, probably the hardest times are when I don't have, control. And in spite of my best efforts, I can't do anything.
Like when someone is just injured or sick beyond help.
Yeah, like, I just thinking about in like very vague terms of someone that I took care of in residency. Mm-hmm. He was sort of like my age-ish now, in his I'm 40, but he was in his mid-30s. Mm-hmm. He had a wife, he had a kid who was like 8, and he had a really horrible, just aggressive blood cancer. And, I spent my days trying to fine-tune these little bits of lab values to try to get them to be a little bit better. And, I had probably one of the smartest people in the hospital telling me what to do and telling me that everything I did was wrong, on top of that. But then sort of realizing that there's just nothing that I can do to fix whatever else is going on.
Yeah.
And, I was with him I was taking care of him for 2 weeks, and it was an incredibly difficult 2 weeks. And then the day I rotated off into a different service, he actually passed away the next day. And there was some, relief because his suffering was over. And I was also relieved that I wasn't there for it, because I think that would have been, I don't know what I could have done, what I would have done or felt like in that moment. I don't know if I would have been frozen, if I would have like jumped into action, if I would have cried or any, that type of thing. So that's those are the things that kind of sit with me.
What does it feel like?
I don't know if heaviness makes sense in a way. Yeah. I think that's really what it feels like. There's definitely a sense of, why do we worry about X, Y, or Z when we sort of have to do, when this is what, this is how this can happen, and this is how it ends in certain situations. I think that's, that is something that really like sticks with me, I think.
Was there something in particular about that person's passing, that meant something to you? Like, I'm sure there's lots of, you're in a hospital, people are dying.
Yeah, I think it was, I would say maybe that it was a perfect storm of just intense pressure of the situation. Not only do you have someone who is, my age, but every day their beautiful 8-year-old kid is coming in to visit, and their wife is the loveliest person ever, and you are like desperately trying to, you want to keep this together in some way. And then on top of that, you have really incredibly smart supervising physicians that are like thinking very outside the box, doing everything they can to try to save this person. And you have the stress and the weight of trying to make their ridiculous plans a reality, and the stress of that. And then I think it's also just the I think I lost a little bit of my train of thought there, but I think those are probably the two biggest things. Is that, finding someone that you can like see like, oh, you could have been in my med school class and married with a kid, that type of thing.
There's an identification.
There's an identification.
With the patient.
Yeah. Yeah.
What does it? I don't want to push too hard, but like, I've been with people who have died, and my father has passed away. There's like certainly in the day, I remember a feeling of like panicked at one point, and manic afterwards. Cycling through all kinds of feelings. I wonder, just like when that happens and you're on the job, like, do you feel, how like in reality do you feel like, or can you feel this right away?
You mean when, like if it's a death while I'm, working as a doctor, or in my personal life?
No, as a doctor. Like this person's passing, for instance. Like, what do you like? What kinds of states are you in the aftermath? Or in leading up to it? Like, it sounds like what I imagine leading up to it is that you're just, it's like go, 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 go.
Yeah.
I'm gonna just keep moving ahead, and then he passes. What?
I think when I was a resident, spending, because a lot of in training, because a lot of my job was really focused on the check boxes, making sure, like the to-do list, making sure you could do X, Y, or Z, that type of thing. I think you spend so much time kind of focusing on that you sort of don't get, there are other parts of, the experience that you don't necessarily appreciate. And so it's hard for me to think about how the death of a patient affected me in a certain way as a resident. A few times that I can really remember it, to be honest with you. And maybe that's just me again, memory holding things. It's hard to say. But there was an appreciation as I became an attending and had a better sense of like the whole picture, that there are some things that we can there are some things that we can control. There are some things that we can't. And so much of the time, a lot of the death that I see is not controllable in spite of our best efforts.
Yeah.
And so I think more, did I do right by the patient to make sure that, they were comfortable?
Yeah.
Did I do right by the family to, get them prepared for this in any sort of way?
Yeah.
That type of thing, that I think has helped it in some way. And then, COVID sort of came and kind of threw that sort of out the window.
Yeah. It's really overwhelming to even imagine what the families are projecting on, like in therapy, we talk about like transference, right? But like the transferential relationship that patients and families must have with you.
Yeah.
In that moment, the weight of that must be, what is that like?
That, I would say sort of appreciating that transference was really difficult in the first few years of outside of training, when I was sort of an attending and the one making decisions, because as a resident, I could say, well, I'm just listening to the attending.
I just work here.
I just work here, like I clock in, I clock out, that type of thing. But if someone is, yelling at you on the phone saying like, what are you doing to help my dad and whatnot, and that sort of like really, really gets to me, to the point where like I'm in tears, I need to step away from my desk, that type of thing.
Yeah.
And then to suddenly realize, oh, they're actually going through something incredibly difficult. This is someone who, very much like me, likes control, and this is a situation that they cannot control.
Yeah.
So what can I do to give them some semblance of control, and how do I sort of help them navigate what they can't control? I think being able to kind of recognize that has helped a lot of it. Yeah. Definitely. It's given me a lot more patience. And it's allowed me to like empathize more with people rather than to take things really personally.
Yeah.
Which is very easy to do if someone is saying, why aren't you helping my father?
Yeah, there's separateness. Like,
right.
We're not actually going through the same thing.
Yeah, exactly.
Can you talk about COVID? Like, is it okay to go there?
Yeah, I think it's okay, because I mean that's sort of what I was thinking about. My COVID experience working in the hospital was very different from someone who was working in the ICU or who was working in the emergency room. I think I was lucky enough to be working at an institution that had a lot of resources where, 1 week, just to sort of think about it, if the hospital has 10 floors and 2 of those floors are normally managed by the patients that I take care of, and the rest of the floors are taken care of by surgery patients and all kinds of other things. In a matter of weeks, they were able to transform an entire hospital to only take care of, COVID patients and not have them waiting in the hallway, that type of thing. So there's those types of things that I, didn't, necessarily, have to deal with on some level. but very, very early on, I think there was a lot of sense of um, just a sense of powerlessness. And it didn't really, it hit like really quickly, I think. I was supposed to, uh, I was supposed to go to see Felice.
Yeah.
I was like,
sorry, pandemic. I'm supposed to be naked in Mexico.
Yeah, I was supposed to have like my when Stella got her group back moment, going there and whatever.
Oh my
And
God.
and my mom is telling me you can't fly, and I'm like, I don't know, you never know, maybe I could. And then obviously literally the day before is when everything shut down, and I was like, well, I guess I'm not going. And so I had all this time, and said, okay, I'm available to come into the hospital. And the first day, I actually didn't take care of that many COVID patients. It was the usual type of patients that come in with all of their different sort of clinical conditions. But this one person in particular, and this just always sits with me. He was in his mid 50s, and he just had a transplant, but he was doing really well. He's on medication because he has a transplant that sort of suppresses your immune system a little bit, but otherwise he was very healthy, active, out and about doing, living his life. And he came in and, with the very classic, like he came in with the fever and shortness of breath and whatnot. And, early on, there was still a lot of hesitation about saying something was COVID or not. We spent a lot of time thinking, oh, maybe this could be the flu. And that was a period when you couldn't, when you had to send a lab test outside of the hospital to get it tested, or there was a significant lag. Like you couldn't just do it immediately to test it because there were so few tests around. And he said to me in this like crowded emergency room, I'm really scared that I have this, whatever is going around. And I said, something to the effect of, I don't know what's going on, but we're going to get you through this. Don't worry. Like, we'll see you through. There's things that we can do. You're doing really well right now. We'll definitely like keep an eye on you. And I went home. The test result would take like 8 or 10 hours. And I saw that the result came back that he had COVID. And so I called him on his cell phone while he was in the emergency room to tell him the result. And then he sort of broke down into tears, like, am I going to die? I'm so, terrified. And again, so there was a lot of, kind of reassurance. And the next morning I went to go see him, and he was actually doing okay. And I thought, we're going to kind of get you through it. And I think it was like an hour or maybe even just a half hour later, in the hospital, you get overhead announcements for if someone's having like a cardiac arrest the codes, exactly. And, a lot of the times you kind of, you'll listen for it and it'll sort of be in the background unless you like recognize the floor, and then you recognize the patient's room number. And so like when you get that moment of recognition, your sort of heart kind of just stops for a second. And in that instance, I don't know how much more than stop I could say. It really just like took the wind out of me because I had just seen him. And we tried to resuscitate him, and I was we spent 30-40 minutes really trying our best, and ultimately we weren't successful. And it was a gut punch. It was like he was fine, and then he wasn't. And then I had to call the family. But the only number that we had on file was of his son, who, when I called, he said, "Oh, we've been estranged." So imagine the first thing that you hear about your father that you have is
that's it.
That's it. And not having any sense of, okay, so who else can I tell? Because I don't have any information at all.
Yeah.
And this is just sort of how it ends.
Yeah.
And then I had to keep going with my day.
Yeah.
So like that one in particular, especially because it was the first one that sort of stuck with me.
And also maybe like talk about like all the ambiguity at the beginning of COVID. Like it sounds like you felt pretty confident that this person could get to the other side of this. Like maybe the stakes of what was happening became more apparent.
I mean, we just didn't appreciate how quickly things could turn and how quickly patients could deteriorate. Over time, I did figure that out, and that it wasn't necessarily the same gut punch. Obviously, it's still like shocking if someone is decompensating in a way that's very quick.
Yeah.
But it wasn't anything that I could have imagined previously.
Yeah.
And that was the first time. So it really sort of hit. Whereas afterwards, I could say, this is actually how, we don't really know how COVID could go.
Yeah.
And so I was maybe a little bit more prepared.
Yeah.
That could be a possibility.
Yeah.
Knowing that it's happened before. If that makes any sense.
Yeah. Yeah. Totally. It's awful. I'm having the experience of like, what I want to do when someone is talking about their heartbreak is like, I'm like, okay, well, what about like, who were you when you showed up to that relationship? What did you think was supposed to happen here?
Yeah.
What kind of unconscious ways were you like working against yourself? And it's the stuff that you're encountering at work is like so concretely bad that it's almost hard to even like it's like a little foggy for me to even start like doing my thing with any of this.
Yeah.
It's just like so on like the plain facts are that's like so brutal.
Yeah.
And so I guess my question is like, what do you do? How do you like hold yourself at work knowing that something like that could happen? Like I wonder if you use the language of trauma. Like is that like a traumatic experience for you?
I mean, I think we don't necessarily use the word trauma per se, but there is this concept of like after a traumatic moment like that, having like a debrief session that didn't necessarily exist as a concept before COVID, or was sort of kind of seen as on the fringes. But has really gained traction. And one of my friends is very good at these debrief sessions, and the goal is really to sort of acknowledge the event and the moment and what happened, and try to verbalize what you're feeling, because otherwise, if you I think of it as like, the thing that comes to mind is a month ago, I was working in the hospital, and I was working with an intern, and this was like her first few weeks on the first week on the service, and the patients that she was taking care of were just really tough cases. And I said, "Wow, these are really tough cases. Are you okay?" And she was like, "No one's asked that." And so it's just being able to kind of acknowledge, this is a difficult situation. and maybe I can't do anything about it, or I can't do anything about my feelings in the moment because I have to go to the next person.
Yeah.
But at least taking that moment to kind of appreciate that. I think that's probably what I would say I would do, kind of what you're sort of getting at.
Yeah. And that like there's maybe part of what's happened since COVID, you're saying, is that there's more, like in therapy, we talk about like, oh, you're making like the implicit explicit, that like there's a curative aspect to that. And that there's more of a culture around being able to do that, that's important. That dissociating the tragedy or the pain of it, that I imagine that could accumulate and add up to something bad for the doctors.
Right. Because definitely you can get to a point where you're incredibly jaded about everything. Because that's the only way that you can actually function is, going from, someone, dying to now you have to take care of this person for a completely different reason and get them, try to get them feeling better. That type of thing that certainly existed and was like prevalent in medicine for a very long time. There are books about it that people valorize, but now are kind of just awful when you go back and sort of read it. But it really is that, making the implicit explicit. It's like taking, even if it's just a brief moment, saying like, hey, we're about to talk about another patient, but your patient just went through something. Do you want to take a second? Do you want to do you want to do anything? Or why don't we give you a moment to kind of like gather your thoughts, and we'll talk about someone else, and then we'll kind of come back to see. It's acknowledging the weight of something and showing that it's okay to kind of take a moment to either reflect personally, even if you're not necessarily doing it, out loud, because some people just don't feel comfortable doing that.
Right.
Just saying like, just take a moment, and we'll talk about this other person. And kind of going from there.
And that's more normalized. Now. I'm embarrassed to ask this, but I'm going to. They do this on The Pit. Do you watch The Pit? They like, there's an emphasis on this moment of like acknowledging the death. I thought I was going to bring up The Pit, but the Pit is a really good example of the best way to do that. When I started watching The Pit, I was actually very frustrated because a lot of those situations are very, like, this is how we teach people to perform those things. It's very hard for it to be that perfect in real life. My takeaway from that show is that, like, maybe the depiction of it is, I believe what you're saying. But like what sticks with me about that show is that it is about how hard it is to do the job. Like being like, how do you be a person inside of this job?
Right.
And so if the depiction is like kind of a fantasy, that to like the non-medical layperson, that message is received. Is that like, this is an extremely like fucked up way to get this done.
It ends up being harder for me to sort of appreciate it in some aspects, although I do really like the show. I have to sort of get over the didacticism of it all. There are times where it just feels like, okay, this is, I read this in a textbook. And you're just like spouting it out the way that I sort of read it and learned about it. This is kind of off-putting. But there is,
because the work is usually, there's like much ambiguity.
There's ambiguity. It's also just, people are more complicated. They're messier. They don't know how to react. They, there's a lot of just discomfort in reacting in a situation like that. I think that's really, that's why I think it's a little bit different. And a lot of people just don't talk like that.
Right.
Like, it's just,
I think it's always hard to watch a TV show about one's own profession. Like I didn't watch couples therapy for so long because I was like, I don't want to feel this way about my work. But I actually, couples therapy, I think somehow feels good to watch. Therapists agree about this.
When I watched The Pit, I remember telling a friend, like, this is obviously sort of an extreme because it's, over an hour and a mass casualty shooting, that type of thing.
Yeah.
But on like the way that it depicted the breadth of the type of cases that you have, where, someone comes in for something that's not as serious, where you can joke with the patient, etc., to something as difficult as, in the first season of the family that had to extubate the father, that type of situation, like that's the kind of breadth that we're sort of dealing with on a daily basis. And this was the first time where it felt sort of true to my experience, even though some of it is obviously
sensational.
Yeah.
What? How did working through COVID change you? Impact?
I'm probably still unpacking that.
Yeah. Well, I was also wondering, I also had a thought about like how is this system, and there's like not one answer to this, but like the system must be traumatized in a lot of ways beyond the individuals.
My personal opinion, obviously, is that the system has tried to move on and pretend that COVID didn't happen, and there isn't necessarily that sort of acknowledgement or changing the way that certain things are done. So I think that really feels like it's like, oh, this worked really well suddenly when we figured it out, and then we just abandoned. We abandoned it. There is a level of camaraderie that people had during that time that is like, that was unimaginable before, and I can't imagine us getting back to sort of that type of situation again.
People talk about like there's reports about English people talking about how they missed that part of World War II. That there was like a solidarity amongst the civilians. That after people were like, oh, that was nice, being kind of, it like united us in a way.
During COVID, obviously a lot of people did, but me especially spent a lot of time alone. And part of it was because, like, how contagious am I? I was coming home from the hospital and throwing my clothes away, and taking an alcohol swab and like cleaning my glasses, trying, we didn't necessarily know what's going on. But I would walk home from I used to work at, I was primarily working at Mount Sinai on like 98th Street, 99th Street. And the trains weren't running as frequently. So I often had to walk to the express stop on 86th Street. And that was sort of, that was my reflection time, just to kind of like, and it was a beautiful time to walk down Park Avenue because the tulips are gorgeous. So many different colors. And so I like really started to stop and appreciate that, because I was like, there's nothing good right now, so I have to do that. But when I would walk home and it would be 7 o'clock and those people would be like banging their pots. And like I can be like a very cynical person, but like those moments like really hit. Like
that's incredible.
Like
I think
really appreciated it for as corny as it was. It like it helped me get like the last like 3 blocks to get to the to get to the train.
That is incredible. Because I think when people are cynical about the pot banging, they're like, who is this for? But like literally it was useful to you. Like it actually did. I think so many of us don't. It's like you like did that, but like to what end? But it actually helped?
And part of me was like, this is ridiculous. You know, why, like, what do people think that they're doing?
Yeah.
But like, you know, there were moments when I would be caught off guard because I wouldn't know what time it is.
Yeah.
And then, you know, the pots would be banging and I'd be like, oh, this is, you know, that.
Yeah,
so like, in spite of my best cynical efforts, you know, it really got to me.
Wow. That's cool to know. I think horniness is underrated. I think it's really necessary sometimes.
Yeah.
What is it? I mean, it sounds, you said earlier, or a moment ago, you're kind of still reckoning with what was that?
Yeah.
Is that the sense among medical professionals, like that?
I think on some level, yes. It may not necessarily have affected how they practice because it was such a unique situation that, you know, we hopefully, you know, don't ever experience again.
Yeah.
But, you know, for me personally, you know, spending a lot of time by myself made it hard to spend a lot of time by myself once things sort of like the post-vax, you know, like post-vax hot girl summer kind of, you know, the situation where it was like, I can't sit at home by myself. I need to be out doing things.
Yeah.
I think that was probably the biggest thing for me that sort of like lingered, where as before I spent a lot of time by myself. You know, we were talking earlier about traveling by yourself. I did a lot of that in medical school without even thinking. Yeah. And
it took on a new meaning.
Yeah. And was totally fine with being at home by myself for so long. And then suddenly it just felt incredibly uncomfortable.
Yeah. Wow. I wonder how many other people like that can't be unique.
Yeah.
It makes a lot of sense.
I mean, I'm just trying to think of sort of all of the different ways. I mean, I know that, you know, friends that I worked with who had kids, like they couldn't live with their kid, you know, because they were so terrified. Yeah. So I think there's that being alone or missing out, that kind of that lingers.
Yeah, yeah, and that the luxury of being able to be around people can go away.
Yeah, yeah,
totally. How do you? What are your burnout strategies? This is personal. I'm asking because mine. Because I spend all day. What is exhausting about my job is actually not the. I mean, there's hard moments with clients, but it's actually just like the exhaustion of like being related, like in relatedness all day long, with parts of people that are sometimes hard to sit with. And so it's like what you were saying about the like accumulation of it before, like that's kind of my burnout thing. And it's, so, but I'm fighting it all the time.
For me, I think I am lucky in that my job allows me to take care of patients or be in the hospital for 1 week or 2 weeks at a time. And then I'm out of the hospital for 2 or 4 weeks. And so I think that has really helped.
Time off.
The time off has helped considerably.
Yeah.
The periods when I'm just on, especially if it is, you know, I'm taking care of, you know, very sick people, you know, that type of situation, it can really wear on me, and I just don't really know a way out of it. It's hard not to think about it and spend all of my time kind of thinking about it. Even if I am trying to watch a movie with someone, I may, you know, check a lab test on my phone while, you know, I'm doing that. So being able to have that time out of the hospital really changed things and made things a lot better. Whereas, you know, in in residency, I I may have 1 day off in a week.
Yeah.
And
why does it have to be like that?
it's that we could spend like an hour talking about that.
Yeah.
And it wasn't until it was in residency really when I realized that I had such like awful anxiety, like crippling anxiety almost, because so many things could go wrong, and that it just completely like just bottoms out my mood. And and once I sort of like realized that and started getting treatment for that and going to therapy, that really helped. And then, but space was really like what I needed.
Yeah.
It's probably it's been the best thing for me. I feel like I could say, oh, I like to read or go to movies or travel, but it really just is sort of space and time.
Yeah, giving your body a fighting chance to reset.
Yes. Yeah.
Totally.
Yeah.
What these maybe show up differently than the other guests, but I've been asking people like, what in heartbreak, what are your like guilty pleasure coping strategies? Like
I don't cry easily. So when like I really fall into like the teenager, let me put on like the saddest music possible, like that kind of thing. I definitely
to induce it.
And there was a brief period of time, which I'm totally okay with saying this. One of my favorite TV shows was Veneno. Did you ever watch that?
So good. I show it to people, and sometimes they're like, "Oh yeah, that's okay," and I'm like, "This is the best thing I've ever seen."
Yeah, the finale.
Yeah.
Every time I watch it, guaranteed I am bawling.
Yeah.
And it just like feels so good.
Yeah.
Like right, just to kind of like just that release and to kind of like let it all out.
Yeah.
That those tend to be my go-to kind of things.
I should let you go in a second, but earlier you talked about, you shared a fantasy about maybe that a date didn't go well because you were aligned with the wrong housewife. This is like, has nothing to do with heartbreak really, but who do you think is the most red flag? Who would you not go on a second date with because they were like, oh, I stan so-and-so? What's the biggest red flag housewife fandom?
Oh God.
I think it's Lisa Vanderpump.
That's a really good one.
I think it means you have a bad sense of humor if you love Lisa Vanderpump. I think she's a good housewife, but but like she's like a necessary evil or something.
Yes. That's a really, really good question. We'll like cut out the time where I wasn't. We'll fix that in post. But I think there is. The first one that came to mind was Ramona Singer.
Yeah. I mean, I think Ramona's like very funny, but she has proven to be just like so abject, like morally abject, that it's really is, even I've like, she can't come back on this.
It's especially like towards like the very end when it was so obvious that she would just make everything about herself. That it just wasn't fun anymore.
The Black Shabbat.
Yes, that's exactly what I was thinking of.
Like, okay,
it was like, all
wrap
right,
it up.
This is, okay, it's time for you to, it's time for you to go. I think probably that, I would say.
Yeah, I agree.
Yeah.
All right, glad we ended on a really sophisticated note.
Yeah.
Surafel, I hope that this, like, I'm curious about how this will evolve for you and like how you'll, I don't know, hang on to yourself in the face of this. It seems so challenging.
Yeah. That's a good question. I mean, I have therapy tomorrow. So.
Let me ask one more question, which is like, when you talk to older doctors, how did they, like, what do you witness in the way that they carry the heartbreak of the job? How did they seem to be managing it?
Um, that conversation never existed. I've never had that conversation.
Okay.
Because it really had been very taboo to show any sense of any emotion or anything, and to even talk about that. In med school, we had a course that was very loosely about sort of empathy and trying to understand different backgrounds and how you sort of navigate difficult situations, cultural competency, that type of thing. But for a while it was really, people were just like, ugh, it's just like for it's just the wishy-washy kind of like course or whatever that people really just didn't really care about it. And I think that's changed a lot more.
Yeah.
But I didn't have those conversations.
But so this is like kind of actually uncharted territory.
Yeah.
Things are in flux.
A lot of it is what I have experienced or I have seen my peers experience. Because I wasn't necessarily getting it from the very senior attendings. I was maybe getting it either from my co-resident or from my like really good friend that sit next to me in the office. That's where I was getting that, like, how do you deal with this emotion? How do you deal with the situation? That type of thing. That's where I was learning it from, rather than looking at,
You guys your like cohort is sort of making this up as you go along.
Yeah. I mean, more than making up, I think. But like, it's.
Wait, what do you mean by that?
I'm saying more than making up because I think there are people that are doing good work looking at, what are the best ways to try to sort of achieve that. I talked about my friend who does, who like has done a lot of work around like debriefing sessions and how that sort of navigate. So there's a lot of work that's being done, but this is all new compared to where it was, when I was in med school. When I was in med school, it was just barely starting.
Yeah.
And so like, 10 or 15 years ago, it's very different now.
Cool. I'm so glad that's happening.
Yes.
It seems like a long time.
Yes. Yeah. Yeah.
Okay. Cool. Thanks, Surafel.
Thank you.
So interesting.
Yeah, this is great.
Cool.